Picture this, it's 3 a.m. The world outside is silent, but you're wide awake, staring at the ceiling, feeling a little anxious. You've just noticed a weird rash on your arm, one that, oddly enough, looks a bit like the map of Australia. It's itchy, it's red, and it's definitely not something you've seen before. So, what do? Wait for the doctor's office to open in the morning? Call a nurse hotline and listen to elevator music for half an hour? Or, like millions of others, you reach for your phone and open TikTok, hoping for answers in the middle of the night. Instantly, you're greeted by Dr. Anya Sharma. She's in her white coat, maybe even doing a viral dance, and right there on your screen, text bubbles pop up explaining what your rash could be. Dr. Sharma isn't just a doctor, she's a social media sensation. With 15 million followers, she's become a trusted source for quick, clear, and reliable medical advice, all delivered in a way that's easy to understand. She busts myths about miracle cures in 60 seconds, breaks down how vaccines work while lip-syncing to trending songs, and somehow manages to make even the most complicated medical topics feel fun and approachable. This is healthcare in 2026, global, instant, and delivered in bite-sized videos that fit perfectly into our busy lives, no matter where we are in the world. The waiting room isn't a sterile office anymore. It's your couch, your commute, your lunch break, wherever you have a phone and a few spare minutes. TikTok doctors are breaking down barriers, using humor, empathy, and plain language to make health information accessible to everyone, regardless of background or education. It's like having a super smart friend in your pocket, someone who can explain what's going on with your body, and maybe even make you laugh about it. But here's the big question. Is this a revolution in public health, or a digital Wild West, where anyone with a ring light and a catchy tune can give advice, whether they're qualified or not? The truth is, it's both, exciting and a little terrifying. There's incredible potential, but also real risks if misinformation spreads unchecked. So, let's dive in and explore this brave new world of social media medicine together. We'll look at the opportunities, the challenges, and what it all means for the future of healthcare. Who knows? Maybe we'll even pick up a new dance move or two along the way, because learning about health doesn't have to be boring. The rules have changed, and we're all figuring them out together, one swipe and one video at a time. The doctor's house call has gone global. Now it's just a tap away, reaching millions with every catchy, informative video. But is this the future we truly want for healthcare? Can we trust what we see on our screens? Let's find out together. Because medicine now comes with a beat, and everyone's invited to join in, no matter where they are. The question is, are we ready for this new era? Let's see what happens next. The old doctor-patient relationship was distant and formal. It was a world of white coats, hushed voices, and a clear line between expert and patient. You sat in a sterile room, got 15 minutes, and left with a prescription, rarely questioning, rarely connecting beyond those four walls. Now, social media has turned that one-way street into a chaotic 8-lane superhighway, where information, opinions, and experiences flow in every direction at once. Doctors are creators and influencers, building communities online, sharing their expertise far beyond the clinic, and reaching people they might never meet in person. Patients aren't just listening, they're asking questions, sharing stories, and supporting each other in real time. They're forming networks, finding solidarity, and sometimes even challenging the experts. It's a global support group, 24/7, right in your hand. No matter where you are, you can connect, learn, and find reassurance at any hour. Doctors are more human, explaining cholesterol while their cat walks by, breaking down intimidation and building trust. The white coat is replaced by sweatshirts and living rooms, making medicine feel more approachable. But this closeness blurs boundaries. When does public info become personal advice? Where do you draw the line between education and a private consultation? Medicine is now a public performance, and the line between education and entertainment is thin. Every post, every video, is watched, shared, and critiqued by thousands. Is the goal to inform, or to go viral? Sometimes the pressure to get attention can overshadow the need for accuracy. The dynamic has shifted, and not everyone can balance it. The world's watching and participating. The stakes are higher, and the consequences more immediate. The question, can we keep the trust and accuracy, or will the performance take over? The answer isn't simple, but one thing is clear. The way we experience medicine is changing, and there's no going back. The numbers are staggering. Over 300,000 verified health professionals are active on TikTok. The hashtag #Doctors of TikTok? Over 50 billion views. People are hungry for health info, and they're getting it from their phones. A single educational video can reach more people in an hour than a doctor sees in a lifetime. The potential for good is huge. Public health messages can go viral for free. But for every real expert, there are countless creatively qualified influencers. Nearly 40% of medical videos contain misinformation. For every solid vaccine explainer, there's a viral celery juice cure. The algorithm doesn't care about truth, just what keeps you watching. Sensational, simple, but wrong advice spreads faster than real science. It's like junk food for your brain. Tasty, addictive, but not healthy. The digital minefield is real. The challenge: how do we find the real experts in a sea of noise? The stakes are high, and the consequences are real. Let's dive into what happens when TikTok medicine goes viral, for better or for worse. Social media has the power to spread health information at lightning speed, reaching millions in just hours. But what does that really mean for our health? The good. The Now I Vax for Vets campaign helped thousands of elderly people get COVID boosters, thanks to simple shareable videos that made the process less intimidating and more accessible. These clips broke down barriers, helping families make informed decisions. Dr. Aisha Khan's Spot the Spot Melanoma Challenge went global, encouraging people everywhere to check their skin and see a doctor if they noticed anything unusual. Real lives were saved through early detection, all sparked by a single viral trend. That's the power of social media done right, turning likes and shares into healthier communities and real-world impact. But then, there's the dark side. The sunscreen is a scam trend, convinced millions to skip sun protection, sparking a public health nightmare as cases of sunburn and skin damage soared. Or the borax challenge, where people actually drank laundry detergent because an influencer claimed it was healthy. The consequences were immediate and severe. Hospitals saw real cases of poisoning, with doctors scrambling to treat patients who had followed dangerous online advice. A dangerous idea can go viral just as fast as a good one. The consequences? Sometimes deadly, and often irreversible. Social media medicine isn't all fun and dances. Behind every post, there's a real impact on real people. The stakes are high, and the risks are real. One wrong message can change lives in an instant. One viral video can save a life, or endanger thousands. The difference is often just a few words or a single click. The difference? Who's behind the camera and what they're saying. That's why it matters more than ever to check the facts, and why we need to pay attention. Every click counts, because in the world of viral medicine, your next scroll could change a life. So, what's the real impact? The blessing. Access. For rural communities or those who can't get appointments, online doctors are a lifeline. They empower people to ask better questions and break down stigma around mental health and taboo topics. Doctors sharing their own struggles build empathy and trust. But the curses? Misinformation is everywhere, and it's hard to tell real experts from convincing fakes. Privacy is at risk. People overshare personal details in public comments. Doctors face burnout from constant content creation and online abuse, and patients may start relying on 60-second videos instead of real medical care. TikTok is a great starting point, but never the final word on your health. It's a supplement, not a substitute. The balance is delicate, and the stakes couldn't be higher. The mess isn't going away, so how do we fix it? First, platforms need better verification and fact-checking. Real doctors should be easy to spot. Digital literacy must be taught in schools. How to spot red flags, check sources, and separate charisma from expertise. Everyone needs a baloney detection kit. Medical boards should set clear social media guidelines for professionals, ethics, boundaries, and best practices. Doctors need support and training to navigate this new world safely. Collaboration is key. Platforms, doctors, educators, and users must work together. Fact-checkers can partner with medical creators to debunk myths in real time. Algorithms should promote reliable sources over sensational junk. It's about building a healthier information ecosystem. The job is big, but not impossible. We all have a role to play. The future of digital health depends on it. Let's make the internet a safer place for health info. Together, we can do it. So, what have we learned together? Doctors on TikTok are both revolution and risk, powerful tools that can educate or mislead. The stethoscope has met the smartphone, and there's no going back. The challenge: embrace the access, but keep your skepticism. Celebrate the good, call out the bad. The conversation is just beginning, and the rules we set now will shape the future. Stay informed, be curious, but critical. Follow real experts, ask questions, participate. Your health is too important to leave to chance or to a viral video. Be an active, smart participant in your own well-being. Be part of the solution, not the problem. And please, don't drink borax. Seriously, don't.